Okay, let's make a start. So welcome everybody to our latest webinar where we're going to spend a little bit of time exploring the connection between mental health and substance use rather. My name's Matt Reed. I'm the head of corporate here at Medigold. I'm going to be your host today. Just before we start, just a few bits of housekeeping. First of all, this webinar is being recorded and we'll send the link out to everyone who's registered. We'll send that out tomorrow. Feel free to share that with colleagues. We hope that you do. We hope you find the information of use. The content of this actual webinar is a commercial product, so we're not going to be sharing the slides themselves, but as we said, you'll be able to revisit anything of interest, hopefully during the recording that will be sent back out to you. Now, we've got several hundred people joining us today, so for obvious reasons, we're not opening up to questions and answers throughout the webinar. You will have the opportunity to ask questions through the Q&A function, so feel free to go. We'll be monitoring those as we go, and we'll come back to questions at the end. So if you do have any questions, Q&A tab at the bottom of your screen, feel free to add as many questions as you like. The more interactive these sessions are, absolutely the better. There will be an interactive session as well, so feel free to put any comments or thoughts into that same Q&A tab. Now, finally, but very importantly, we are covering the topic of both mental health and substance abuse in this webinar, both of which can be triggering for some people. So please ensure that you are in a safe place and have the support that you need in case you find any of the topics triggering or troubling. Now, without further ado, let me introduce our panelists. Kim, would you like to start?
Yeah, hi, good afternoon, everybody. My name is Kim and I work in the Disability and Health team. My role essentially over the past 3 years has been to help businesses across the UK to develop a supportive culture for workplaces. So on the topic of mental health, delivering courses such as mental health first aid and things like that. So that's predominantly what I do. Jim?
Thank you, Kim. Hi, guys. My name's James and I work in the training team within the business, purely in the alcohol and drug side of the business. So I spend a lot of my time on policy revision, training resources, and then delivering the content around drug and alcohol, not only in society, but also in the workplace and how we manage that within the workplace. And Judith?
Hello everyone, my name's Judith. I'd like to thank you for joining us in our session on substance use and mental health. My background is in clinical and in health psychology, and I'm currently head of mental health at Medigold Health. I have over 15 years experience working within the NHS, public health services, and I focused a good portion of that time on addiction and substance use, partly through research into the neurobehavioral mechanisms of addiction and partly through public health projects to prevent the onset of problematic substance use at a population level. So I will start our webinar off and then I'll hand over to my colleagues Jim and Kim at different sections of the webinar. So in today's session, our ambition is to explore the intricate relationship between substance use and mental health. We aim to shed some light on how these elements interact and influence each other. And with our expert insights and compassionate understanding, we'll also discuss the risks and the challenges, share lived experiences, and look at effective strategies for prevention and support in the workplace, with the goal to heighten awareness and to promote better mental health for all. Next slide, please, Matt. So let's start with looking at some data describing how mental health and substance use are connected. We know that many people in the UK regularly drink alcohol or use drugs at least occasionally. Of those seeking treatment for substance use disorder, over 60% say that mental health problems are a factor of their presentation, and about a quarter of people with mental health needs do not receive any formal support with this. Next one, please. We also know that people with alcohol dependency carry a much higher risk of suicide, as well as a higher risk of depression and other mental health conditions, such as schizophrenia, or personality disorders. Next one, please. Half of all the people with substance use disorder receive mental health treatment, and adults with drug dependence are twice as likely to use psychological therapy. Last one shows us some data around the prevalence of self-medication, which means people using drugs or alcohol to lessen the impact of some of their symptoms from mood or anxiety disorders. So now, what does this data actually tell us? It shows us that substance use can impact mental health and lead to problems, but it also shows that mental health problems may lead to using substances in a way that carries risk. And here we're already seeing a bit of the chicken and egg dilemma. What came first? Was it the mental health problems, or was it the substance use? And more importantly, does that even matter? Also, the line between problematic and normal substance use is not always clearly defined, and often there are many, many steps between those 2 points. A lot of people have a drink or try using or try taking a drug, and they don't develop a dependency, even though they may at points be misusing or abusing substances. My colleague Jim will later on explain a little bit more about these thresholds and the terms. But for now, let's look at what makes some of us more prone to develop problems with substance use or poor mental health. So it sure looks like substance use is a real problem for many people, but it's also visible that many more people use substances and are not substantially impacted by their use. So who is actually at risk? Some risk factors have been fairly well established over the decades. They include genetic predisposition to addiction. They include exposure to drugs or alcohol at a very young age. Other vulnerability factors include poor mental health and mental health conditions such as depression or anxiety, stress and trauma, and lack of access to resources and support systems. All make us more vulnerable to develop problems with substance use. And as we are looking at substance use and mental health in an occupational context, I also want to highlight some work-based factors that are associated with problematic substance use. Long working hours and shift patterns disturb a person's circadian rhythm, which has been linked to poorer mental health outcomes, and using alcohol, medication, or drugs to help people fall asleep or stay awake. Other factors that increase a person's stress levels, such as high-risk work, like high physical demands, monotonous work, tight deadlines, job insecurity. All of these factors that you see here on this list have been associated with both poor mental health as well as substance use. And this further underlines the relationship between both of them. Next slide, please. So how does it work? How does substance use impact our mental health? And how does our mental health influence our substance use? Well, it's a double-edged sword, or maybe it's more like a really sophisticated multi-tool. People with drug and alcohol problems come from all demographics, and they can be any age, any gender, any ethnicity, or social economic background. Many people who misuse substances successfully maintain jobs and families and may exhibit few external signs of their problems. This ability to mask those symptoms of their misuse doesn't mean they don't need support. So, why do some people develop problems with substance use? Now, what we're looking at here on the slide is the biopsychosocial model. And this is a comprehensive approach to understanding human health and illness, integrating factors across 3 primary dimensions: a biological, psychological, and social. The biological aspect considers genetic predispositions or physiological states, and the psychological dimension includes personality traits, thoughts, emotions, and behaviors. The social component evaluates the influence of socioeconomic status, community, and culture on health. And by considering these interconnected dimensions, This model offers a holistic view of an individual's well-being and health, and also can explain the complex interplay of these factors and how they contribute to physical and mental health. So highlighted in this triangle, in this model, is the effects of substance use. And they can be both the factor contributing to health or ill health, like through prescription medication, but also through recreational drug use, having a few drinks with friends. All of these can have positive effects as well as negative effects. Substance use can also be the result of poor mental health or the result of adverse social factors. For example, substance use can be initiated due to a physical or mental health problem. If you are in pain and you're taking prescription medication, or if you're in pain and you don't have prescription medication, but also feeling anxious, feeling low in mood. This is what we sometimes describe as self-medication. Then for some people, those biological factors are very strong, and they quickly can lead them into developing problematic substance use. And for others, a combination of several adverse factors has to come together for their use to become problematic. Next slide, please. So I would like to highlight how this may look through two personal accounts of patients I have worked with. If you read through Anna's story at the top, Anna has a very strong genetic component that makes her more likely to develop alcohol dependency, as her dad was an alcoholic as well. Growing up with a parent who struggles with a substance dependency has a profound impact on your psychological health, as well as your social context. Children from such households often face some level of neglect, but also are at an increased risk of experiencing violence. This will shape their emotions, their thoughts, and behaviors, which all fall under the psychological component of the model. And often their social context is shaped by that as well. So Anna, for example, did not register her alcohol consumption was problematic, as she thought of drinking during the day as a normal behavior. She started hanging out with friends who were of a similar mindset, and which further normalized her problematic alcohol use. On the other hand, we have Faisal's story, which is in the box in the left bottom corner. So I just want to read that through with you. So Faisal says, I never was much of a drinker, but when my marriage broke down, I was becoming very depressed. There was a lot of pressure at work, and we were going through a lot of change at the time. I isolated myself more and started having a drink in the evening to relax. That quickly spiraled, and I was having a drink at lunch as well to manage my stress. Soon one drink at night turned into a bottle, then two. I started being late for work, which increased my anxiety and worry about job security, which led to more drinking. My friends started asking questions, and I reacted very defensively, which caused tension and increased my isolation. So what we begin to see here is that mental health and substance use are almost always connected. I will now hand over to Jim, who will dive a bit deeper into different ways people use substances, how they affect them, and how we can scaffold support in an occupational context.
Thanks, Judith. Yeah, so one of the key things we would say then around terminology is there's so many words that are used to describe how someone consumes something, but there's a lot of, well, I should say, lack of understanding sometimes of what each word actually means. So we're just going to delve into a couple of these words, because when you read them to yourself, apart from dependency on the far side, the other three seem very similar, but they're all talking about the consumption of substance in a very different manner. So when we deal with impairment initially first, this is more so about, let's say from a work perspective, the confirmation of levels, the confirmation that there is a certain level of illegal or an illicit, an alcohol or an illegal drug in somebody's body. They've consumed something to a point, a bit like a drink drive limit is a way of looking at an impairment limit. We all know that on the road there is a limit that we have to be with under, and B below in terms of drinking and driving. And those limits, when we breach them, confirm the impairment level. So that word, especially in the workplace and especially through policy, is used a lot to confirm the physical amount, how much is actually in that person's body of whatever substance that may be, and is that above or below a particular threshold, like a drink drive limit, for instance. So like I said, that one's predominantly defining the cutoff points ultimately. But then when you jump into misuse and abuse, there are two words that sound very similar, but they're very different. So when we look at misuse, this is more about improper consumption. So if you take a medication, for instance, it's a legal substance that can be prescribed to us, but it can also be an illicit if you haven't got a prescription for it. It could be illegal to possess a medication without prescription, for instance. So if we had somebody using a prescription drug that wasn't theirs, you would class that as a misuse, because even though it's a legal substance, they didn't have the legal right through Medicines Act at that point in time to actually be taking it. Or you might have someone who has a prescription, it is their medication, it is prescribed to them, so therefore they can take it, but they're taking it away that's breaching those prescriptions. So again, they're going above the levels and they're consuming more than that kind of legal dosage and legal amount that their prescription allows them to take. So whereas impairment is kind of hitting a threshold and confirming that someone's gone above it and are therefore impaired because of that drug, the misuse element, like I said, is looking at that improper use of something, such as a medication, for instance. Whereas when we get into the word abuse, this is getting more into then the intentional use of using something purely for the effect. So where someone's using cannabis to relax themselves, or something like cocaine to get high and produce energy within their system. And the abuse bit is more about that they're taking it not for a medical purpose, such as a medication, for instance, or for pain relief, but they're taking it purely for the intended reaction that drug is going to have on them, the effect that it might have on them. So even though, like I said, misuse and abuse do come across as very similar words, they're very different when we look into the definitions of them. And again, when we revert this issue into a workplace, which is predominantly then dealt with through alcohol and drugs policies in the workplace, these words need to be very clearly defined so that not only the business, but also employers of that business fully understand the terminology around what we're talking about. Dependency then is slightly different as well. And what this gets into is when someone's got that uncontrollable urge to use. Now, the reaction that it has on them could be physical, it could be psychological, it could be both. And what you would normally see, because we can all change from one day to the next, depending on our current mood and our current mindset. But what you see with a dependent, it becomes more of an habitual adaptation, is something terminology I always use, and you see this permanent adaptation in the individual. And they become someone else, like I said, either physically or psychologically, or even both, because of this continual presence of this drug that they are losing control of in terms of taking or not taking. There's also a big debilitating element in this as well. When you have someone who's suffering with addiction and dependency, if there was a very rapid withdrawal of that drug, it would trigger additional symptoms, intense debilitating reactions because of the removal of that drug as well, because they'd become adapted to it. I suppose one way of looking at that, for instance, if you think about alcohol, which is something that many of us know very well as a substance, if you consumed it, you would slightly change in your behaviors while you was under the influence, but you wouldn't stay permanently adapted in that state. You wouldn't stay drunk. You would sober up. The body would break the alcohol down. It would remove it from the system, and you would revert back to normal default personality type. So, there wouldn't be a dependency there as such. But that routine use of it, like I said, long term then starts to cause this physical, psychological adaptation, almost a new persona that this person starts to present on a regular basis. So yeah, the definitions of these words become really key. Next slide, please. We've also then got to consider where these drugs are all coming from, and you could define these in many different ways, but there are 4 basic groups you can break drugs down into. You'll have a stimulant group, depressant group, opioids, and then the hallucinogens. And these groups will all have legal and illegal elements in there. Now, in the stimulant group and the depressant group, we see a lot more of the more common drugs that we know of, both legal and illegal. So in the stimulant group, for instance, we would have caffeine, we would have nicotine, tobacco, they would be in there. But we'd also have some of the big illicits, such as speed, ecstasy, cocaine, they would be falling into this group. And this is typically that group of drugs that generates that energy-like state. Very energetic individuals you would see on this particular substance, dilated pupils, and like I said, heightened energy that it almost creates. And it's not that the drug is giving energy, it's just unlocking energy that's already in the system. It's giving you quicker access to the energy that's already in there. For the depressants, though, again, very common drugs would fall into this category. Alcohol, cannabis would probably be the two most well-known that fall into this category. But you'll also see substances in the depressant group, things that we know people take but aren't intended for that purpose. So if you look at solvents and gases and glues, we know they're designed for a very particular purpose, usually in some form of construction, for instance, or if you look at gas, for instance, it's used in whippy cream cans, it's used in cafetières, it's used in bike pumps. So there's lots of legal purposes for these glues and gases, but sadly we know some people use them as a drug as well. So it won't always be that it's an obvious substance. Sometimes it'll be a substance that isn't safe for human consumption at the end of the day, isn't intended to be consumed, such as a gas or a glue. But I would say the stimulants and the depressants are definitely where you find them the most commonly used and abused substances. Opioids, you pick up on a lot of pain relief medication. So prescription grade medication such as morphine, you might see tramadol, codeine, for instance, would all fall into this category. But you would also have very big illicits such as heroin as well, which would fall into this category, which is an opiate itself. And then the hallucinogens, yeah, the very crazy drugs, LSDs, magic mushrooms, ketamine, people that are using these drugs for that very strange auditory, visual, hallucinogenic effect. I would say as a business, in terms of our contact with these drugs and where we see them more frequently, it's definitely the first two drug groups that we see the biggest problems with. We see them more frequently in the workplace, such as cocaine, cannabis, alcohol. Medication, not as much, and hallucinogens, very, very rarely. But the main thing to consider here is that illegals and legals can fall into any category. They can have multiple effects on the individual. And in the workplace, if you see signs and symptoms in somebody, it doesn't mean that it's definitely one of these things that is causing it. It could be a lifestyle factor. There could be a bereavement in the family. They could be struggling with finance or a relationship breakdown. They could have other health-related issue that's causing the signs and symptoms. So signs and symptoms of drug use doesn't always confirm that it definitely is, but it could be an underlying factor to what we're seeing in this individual. Next slide, please. Now, the most common one that majority of us do know is alcohol, but I would say in my experience of being at the business, one of the things with alcohol is that because it's so cultural in this country, so ingrained into our society, it's very easy to forget what it actually is. It is a drug. I suppose one way of looking at it, it is almost a poison on the body. It's, you drink too much of it, and we all know the reactions that we can have from it in terms of sickness, etc., and hangovers, headaches, etc. So we can get a lot of adverse reactions to this, but it does give people merriment. It does give people changes in behaviors. It does make people relax, and it is the common go-to drug in this country. But I would say the biggest thing about it is that so few people that I come across, when you actually start looking at what it is, truly know exactly what it is in terms of units. Now, alcohol is defined as a unit, and it dictates how much alcohol we're consuming per drink. And I would say the only problem with that from the right-hand image is those percentages you can see there, the half a pint or the 125 ml wine or the 25 ml spirits. These are the amounts and the percentages that define officially 1 unit of alcohol. But in reality, that's not what we get served. We can get served different amounts, different strengths, different drinks from one to the next. And even though there is a defined amount of what 1 unit is, it is very rare that we drink that. So when you look at a pint, for instance, the common mindset is 2 units per drink. But that comes from that terminology that you can see on screen at the minute. Half a pint of 3.5% is a unit. Therefore, the full pint would be 2 units. And that's the kind of the common adage that most people have, that the pint is about 2 units. But at 3.5%, that's a fairly weak drink these days in the UK. We generally drink stronger percentages than that. And you would say that the average pint these days is more like 2.8 to about 3 units per drink. When you look at wine, and people see it as a unit or a spirit, and they see it as 1 unit per serving. Now, you take the spirits, for instance, 25 ml is not an optic that you see as frequently anymore. we generally see 35 ml or 50 ml or even 75 ml. And when you look at wine, 125 ml of 8% for 1 unit. The common drinks now in the UK, when you go into the pub, 10, 11, 12% in terms of strength, and serving sizes 175, 250 ml. Now, if we're not really, and I'm never expecting anyone to take a notebook and pen to the pub and kind of jot down what they're drinking and do a little bit of maths, but if we're not too sure of what's in the glass, not only from a safety point of view when we go back to work, but also from our own health point of view, and as Judith was just saying about maybe coping mechanisms, if we're not truly aware of what's in the glass and all we're ever controlling is, I had 2 glasses, therefore I didn't drink much, we're not really in control of the alcohol consumption. All we're in control of is how much fluid I was drinking, not how much alcohol I was consuming. And the unit content is really important just for a very quick analysis of what actually am I consuming when I drink, how much am I putting into the system. And then last slide for me, please. Now, one thing to think about managing this then in the workplace is it needs to come from 2 elements. We need a protection element, we need a support element, and it needs to be finely balanced between the 2. We need to try and create a safe and efficient working environment for our business. And for anyone who works for us, we need to make sure the environment is first and foremost safe, so there's no impairment within the workplace, but also that there's no effect on our efficiency and our effectiveness as a business. And alcohol and drugs isn't affecting that in any way. And that could be someone who's just completely in control of their drug consumption, or it could be someone, as Judith has already mentioned, who's now starting to struggle with mental health connections to or addictions with the drugs that they've got. So what we need to have in place is, let alone training for our staff and those that work for us, and education and knowledge on subject matter, we need a very well thought out policy that has a good structure that covers all bases. It needs to sit itself in line with legislation. It needs to have some of the definitions we were just looking at a minute ago, so everyone is crystal clear on what it means. And within that structure, we need to cover things like, what is the reason for this policy? What is the aim and what is the purpose? What are the rules and responsibilities that we all need to comply with? If there is any form of screening or testing, what is that and how does it work? And what are the circumstances when it would be used? And in terms of support, which is the big key element today in line with mental health, how would we access and use that support and get access to treatments and support networks if and when we ever needed them? And when we're managing an individual or an incident or a situation within the workplace, we have to make sure that we understand all the facts and information that are around that particular circumstance and that situation. We need to make sure that we are treating people fairly, that it's more about fitness of work and not about what they do in their private life. But the issues that they may have in their private life, which they could come to the workplace, we then need to deal with it from a workplace perspective. We don't want to be judging people, giving our personal opinion on what we think is going on. We don't even need conversations about their private life. We need to keep this very work-related when it becomes a work-related issue. We need to discuss the consequences of their behaviour, but also the process, and reassure them of what could happen next and how we could support them. And it typically would then go down different avenues depending on the particular circumstance. Have they utilised OH already, HR, helplines externally or externally? Are they already receiving treatment for a problem that they've got, or is this something new that they're talking to people about? Can we provide support procedures? Can we help and assist them with a problem that, when you get into the realms of dependency, is still defined as a medical condition, something we need to support? And any decision that we make as a business, making sure that it's based on fact, not on opinion, not on hearsay, not on whistleblowing, but on facts about the case that we're now dealing with. And whether it's an impairment, misuse and abuse, a dependency, we're all fully clear on what the case is, what the problems could be, and how we then deal with that fairly. Okay, I'm just going to pass over to back to Judith, I believe.
Yeah, thanks, Jim. So what I would like to highlight a little bit more before I hand over to Kim is why it's important to think about a policy framework around substance use in your workplace, and that's fairly easy, as Jim has already started to talk about. The list of risks from substance use is long. It doesn't really matter whether it is in which category it falls. I use substance use as a term going forward, but it also should cover substance misuse, abuse. What we're talking about here is the consequences and the risk that it carries. So Excessive use specifically can lead to accidents and injuries. But also a one-time use can lead to accidents and injuries. So that can be to yourself or others. It carries a risk for your physical health, such as heart, liver disease. It carries a risk of damage to tissue to your brain, which may lead to neurological, cognitive consequences, and specifically excessive alcohol use has been linked to certain cancers. The cognitive consequences are mostly reflected as memory loss, memory impairment, or significant behavior changes. And again, here we don't mean substance-induced behavior changes. So while you're under the influence, we're talking about behavior, how behavior can be more permanently changed, meaning even when you're not using. So substance misuse and abuse also carry psychological risks. It can exacerbate existing mental health problems, but also lead to developing new problems that have not been there before. Anxiety and depression are the most common mental health problems that we experience, that are also linked to substance use, but certain drug use can also lead to experiencing more severe or more complex mental health conditions, like, for example, psychotic episodes or even psychosis. And because nobody's an island, excessive substance use always affects those around us as well. It impacts our relationships, personal and professional relationships, and that can lead to problems. In a worst case scenario, this may lead to unemployment and even homelessness. Violence, antisocial behaviors, and other risks, that is higher for excessive substance use, and that further strains relationships, including in an occupational context. So what starts as occasional use can become more excessive over time. It can lead to misuse or abuse, and for some to dependency and addiction. To prevent those consequences from spiraling a person further into a negative spin, early intervention is really key. Next slide, please. So if we're talking about occupational health in this context as well, I just want to give a quick overview how occupational health can play a role and can assist you with that. So if you have access to occupational health, then how can you best make use of this? So occupational health professionals can provide an assessment of an individual's health needs, including identifying work-related stresses, as well as risks to self and others. They can provide advice on a successful return to work after a substance-related absence, and they can provide fitness to work tests and offer signposting to other services. Next slide, please. So what can we do to prevent or manage substance-related problems in the workplace in more detail? As I explained earlier, work is often only one aspect of the complicated puzzle that has led into problematic substance use and or poor mental health. And we need to recognise where we can play a part and liaise with other services and stakeholders to provide the best possible scaffolding to help people get back to good health or to prevent them from becoming ill in the first place. The step care approach that's described on this slide, the step care approach to substance misuse is a method of matching treatment intensity to an individual's specific needs in a systematic way. It starts with the least intensive care, such as education, support, and advice, and it progresses through to more intensive treatments if necessary. This model is designed to make the best use of available resources and avoid unnecessary interventions and treatments, and it has been shown to be very effective in reducing overall drug use. It's a flexible framework that can be adapted to individual needs and ensuring that each person receives the right level of care at the right time. So the options range from raising awareness, educating people, to psychological therapy, withdrawal management, and maintenance therapy. And the role for employers, so for the occupational context, is found on the left side of this spectrum, on the prevention, on the early intervention side. But it might stretch a little bit into the more specialized domain, for example, when you're supporting a colleague coming back to work from a substance-related sickness absence. So as an employer, you might want to offer some informational support, educational material. You might have an employee assistance program for counseling, or you might want to think about subsidizing your employees' access to health apps. If you have access to an occupational health service, you might want to utilize that to support a colleague coming back to work or to assess somebody's health and mental health needs. It is really crucial for employers to make sure that the workplace is a safe place, physical as well as psychological aspects of it, and that risk factors such as working conditions, culture, and stress are appropriately managed. There are many things that we can do to support colleagues who struggle with their mental health, and it often does not matter if substance use plays a role or not. What we can do to support them stays the same. I'll hand over to Kim now, who's going to talk you through, dive a little deeper into how this can be done.
Thank you, Judith. So yes, as we've talked about, really important to identify and become aware of how people's mental health in the workspace is impacted. And whilst diagnosis is important, as Judith talked us through in the link with substance use, actually we're going to bring it back to a topic that unfortunately a lot of us have probably experienced, and that is the topic of stress. So hopefully everyone's looking at this topic thinking, yes, stress, I have experienced this before, and normalizing the conversation of how it impacts our mental health. Whilst it is not a formal diagnosis, signs and symptoms of stress are very, very common. So what is stress? Stress is the reaction we have to excessive demands or pressures that are placed on us. And these can be quite big stresses or quite small stresses, like losing your keys in the morning, and it creates a reaction. So what I'm going to do is I'm going to invite you all actually to share some of your signs and symptoms of stress. Now, I want you to think about yourselves. How does stress present in yourselves, but also your team? If you're a manager on the call, what do you notice with other people in your team and how stress presents? And again, transferable to outside of work as well. So let's get some thoughts in the chat box of how stress can present. So Joanne started straight away with irritability. Absolutely can resonate with that one. So feeling quite irritable. Short-tempered is coming through quite a lot. Sleep is a very common one, and in fact can spiral into other symptoms of stress, can't it? Insomnia, yeah, absolutely. Anxiety, I know Judith talked about anxiety disorder earlier, but actually feeling anxious is a very common symptom of stress in itself. Anger, yes. Can't focus, very good with cognitive symptoms. Mood swings, forgetfulness. Unable to switch off, yeah, that's a really common one. Hair loss, thank you, Darren. Overeating, Joanne just mentioned a behavioural change potentially, so consuming more food or maybe undereating even. Physical symptoms like headaches, yeah, Claire, definitely. Digestive, bowel issues, undereating. And try and read as many out as I can. There's a lot coming in. Short-tempered, yeah, not eating again, emotional, tearful. Nausea, common, IBS, panic attacks. That feeling everything is racing and you have no idea. I can definitely resonate, Julie, with that one. Headaches again. As you can see, there are lots of similarities coming through with what people have mentioned. Drinking lots of coffee, Sheila, yeah. Lack of engagement. Good. Doom scrolling is a very common one coming up now, especially with the age of social media and things like that. Poor hygiene. Okay, clenching teeth. So thank you all for sharing. I'm hoping this exercise highlights how common and normal it is, unfortunately, and actually some of the symptoms coming through are shared. You know, there was loads of different ones, but actually loads of similar symptoms coming through as well. And Steve, you've just highlighted one of the kind of higher risk, which is around feeling suicidal. Absolutely can lead to things like that. So if we click through some of the signs and symptoms on this slide, which will echo really some of the ones you've talked about. So the first box here is cognitive. Some of you mentioned concentration and memory. Absolutely will have an impact on our performance at work. Really difficult to spot maybe for others, but you might notice work and productivity levels have been impacted. Something if you wanted to look into a little bit more off the back of this webinar is negative thinking. So something called thinking traps or cognitive distortions. If I say the phrase catastrophizing or personalizing, you might think about, yes, that's me, I fall into that. And there are about 10 or 11 different thinking traps. So again, stress can induce to go into some of these thinking traps. The next box on here is physical. So I think this box is very small, and there'll be loads of different ones, things like hair loss that you've mentioned, acne. But just to name a few, when cortisol, which is the stress hormone, I'm just seeing, yeah, stress hormone coming through, can impact our physical health as well. So headaches, sweatiness, muscle tension, feeling sick, as you've mentioned. The next box is emotional. So we've split them up into these boxes, but we can see a crossover. A lot of people might go straight to thinking about irritability or feeling anxious or depressed and low mood. Absolutely. But one there to call out is feeling numb and actually not having those emotions at all. That can be quite high risk. When we're thinking about substance use, a lot of people might turn to drugs and alcohol to start to feel something. So again, when Jim talked about coping strategies, we can see that these signs of stress can really link with our coping strategies in that space, which then links with the behaviours on the next one. Quite a lot of things are related to habits that we form. So eating and our appetite changes, smoking, alcohol or drug use, absolutely, that habitual use potentially. And other things are around withdrawing, a lack of motivation, or fidgeting, etc. I noticed a few messages coming through about, well, is having a glass of wine okay in the evening? Absolutely. You had a stressful day at work and you have one glass of wine. I'm sure a lot of us might go to the glass of wine or the beer. It's when it becomes in excess, in accordance to the NHS and the guidelines, and we're noticing the more we are leaning on alcohol and drugs when we're stressed out, actually that's the point where we might want to consider helpful coping strategies. So first step, looking at the screen, loads and loads of different signs and symptoms. So if you're a manager, you might notice some of these things. You might notice it in yourself. And so what do we do if we start to notice these signs and symptoms? Okay, so having conversations is one of the most underestimated things we can do. And, you know, it doesn't get enough attention. It's just having that conversation can really be beneficial for somebody. Now, this conversation is without judgment. This conversation is hopefully building a safe space for people. And some of the things that we can consider on the slide here are things like setting enough time. Now, yes, it's kind of common sense to set enough time, but I'm sure you've all had conversations with people where you know they're not listening to you. Their emails are going off, their phones are going off, chat messages are coming through, and that person can feel quite dismissed. So when we're having conversations about mental health in particular, it's really important that we do set enough time. If you don't have enough time, if we can be transparent with the individual and say, I've only got 5-10 minutes at the moment, but I really want to hear what you're saying and telling me, then great. The more transparent we can be, the better. You know, we're all busy people, so just making sure that we are making sure it's convenient for both parties. Open questions. We want to be curious. We want to explore that person's experience. So I know Jim said, you know, what people do outside of work, that doesn't impact us. What I'm going to say and suggest is that if it's not impacting the workplace, but you notice signs and symptoms of stress, that we might want to explore what's going on for you. Can you tell me about if there's anything that's bothering you? We can't give fix-its or solutions, so we can absolutely have that conversation, and people often feel better when they've shared. There's an acronym that I use, TED, T-E-D, tell, explain, describe. Great way to start those conversations off. Tell me about your experience. Can you describe what last week was like to me? So you get a bit more information. So active listening skills, I'm sure we've all got great listening skills, allowing somebody to talk and giving them that space and showing that compassion. Okay. Information, creating a little bit of a toolkit of support is also a great thing to have if you notice that they are stressed over a period of time, and being able to signpost to different spaces. But of course, expressing empathy and showing that you're there because you care about that individual. Okay. Things like sitting next to each other rather than across from someone. If you are a manager on the call, there is a power dynamic in that relationship. And the person that you're speaking to might feel uncomfortable or might not want to share. So again, just trying to ease off and making sure that we are not intimidating, or we are giving them a safe, comfortable space. Okay. The one on there that talks about judgment. Now, it can be very easily done when we are talking about maybe stresses or behaviour changes. If somebody's coming in smelling of alcohol, for example, it can be really difficult to have that conversation. There's risk factors there. So on the next slide are just a few examples of, if you do notice some stresses or stress symptoms, or you notice some behaviour changes with alcohol, drugs, the first thing to do is ask, are you okay? What is everything okay with you? What's going on for you? How are you coping with things at the moment? And it's non-judgmental space that can allow people to share and kind of talk through what might be going on. Now, we're not here to be counsellors or therapists or anything like that, but having that conversation has great power. There might be that sense of relief for that person that they were able to share, and then we can get them the right support. Okay, so non-judgmental and a compassionate space. So some of the examples: I've noticed you've not been yourself. Is there anything you'd like to talk about? Let's see if we can collaboratively find you some support together. Okay. It's likely, like Judith talked about, it's a double-edged sword. We don't know what came first. Was it the alcohol dependency, or was it because they've just gone through a period of stress, which has caused that? So let's find some support. Okay. On to the next slide then. These are some tools that you can use in the workplace. Now, all workplaces should have a stress risk assessment. If you don't, check your intranet, maybe it's maybe one of the policies or your managers. If not, if in doubt, go onto Google and there'll be templates of these online, loads of templates around stress risk assessments. It's likely if you notice symptoms and you're having a conversation with somebody, these can be really great conversation starters. So it's a structured way to have conversations about how you might be able to support in the workplace. Okay. So demands, is it too much work? Control, what autonomy do they have? Support, relationships with other people, role, change, other big changes that have happened. So this is all supported by the health and safety management standards, but the stress risk assessment encourage you to use it not as a tick box exercise, but as a real tool to support that individual in the workplace. The Wellness Action Recovery Plan, very similarly, is a collaborative working space for you to set goals, to share next steps on how to support somebody's mental health and well-being. Okay, identifying some stresses and being able to collaboratively decide what are we going to do in the workspace to support you. So again, if you can't find one internally, check online. There'll be loads of templates of these as well, but really great tools to help with those conversations. Okay. A phrase that I often use is listen to understand, not to respond. And whilst we definitely need to have some sort of solution or fix-its if you're managers, sometimes listening to understand the situation can help. So leading on from having these conversations, as I said, building a toolkit of support services is also valuable. So on this slide here, you can see some starting points for alcohol, drug addiction, gambling, some of the topics we've talked about today. There are loads of different support services when you go online. It can be overwhelming. So this is a really good starting point to lead you on to find maybe more specific or more local support services to you. But as I said, take note of these. You'll have the recording to come back to if you want to. But really good starting points for information and resources to download. And on the next slide as well, we've got some mental health related support services. The top ones are helplines. I would always say have a backup of a backup. These helplines can get really busy. So please keep a couple of these numbers to hand and use them as you feel necessary. The Shout text service, it might take a couple of hours for you to get in contact with somebody. So just be mindful of that. Starting points for charities. Rethink and Mind, for example, great starting point. And one that I talk about a lot is Hub of Hope, the one in the bottom, hubofhope.co.uk, or download the app. This is if you want to find more local support services in that person's area or in your area, pop in a postcode, select the category, might be alcoholism, might be drug addiction, might be depression, and it will bring up local support services in the postcode you put in. So really, really great tool to use. And dual diagnosis, as Judith said, the double-edged sword, dual diagnosis support services look at both, for example, depression or alcoholism. It won't just support the one. So again, a really great support service to look at both of those challenges. So that's kind of building up a little bit of your toolkit, and there's the end of our webinar. So I'm going to open it up to questions, which myself, Judith, and Jim will be very happy to answer.
Thanks, Kim. Thanks, Judith, and thanks, Jim. Really, really fantastic webinar. Lots of information, lots of good stuff for people to think about. And as we mentioned, we'll be sending out the recording tomorrow for you all to use and hopefully to share as you deem fit as well. So if we're going to look at some of the questions, we've got about 5-10 minutes left. So the first one is, how do I approach an employee if I'm worried about their alcohol intake and I don't want to sound accusatory? Jim, do you want to pick that up first?
Yeah, sure. So obviously within the workplace, to be worried about someone, you would naturally have cause for that, a sign or a symptom or a behavior change in the individual. It wouldn't just be guesswork at this point. Something would have triggered that response, and something I use a lot in my background over the years in different industries I've worked in, but my short background has been in human well-being, so whether it was nutrition or fitness or psychological. And something called PAP is something I've always used, and it stands for personality, appearance, and performance. And now we all have personality, appearance, and performance levels, and they all change from one day to the next. And there's usually very natural reasons why they change. I had a really bad night's sleep last night, and my performance is off a little bit today because I'm tired. And there's usually a natural reason why that PAP shifts. But when someone starts to have a permanent PAP change, you can never guarantee what's driving it, but there's definitely a new habit behind the PAP shift, because habits are what form us. So in the workplace, never feel worried about accusing someone of something, because you're never going to stipulate what you think the cause is. But what you can always do is open up with simple questions like Kim was talking about, based around, first and foremost, I've got a concern. And if it was alcohol, then the concern could be, I have an alcohol concern. And you're not accusing them of anything by talking about the subject matter, because you aren't saying that they're consuming it or appear under the influence or are drunk at work. And open up the question to ask them to explain, see if they can bring any information to the table. In the workplace, confidentially, you could ask about, are there any medications that you're on that I'm not aware of, or a condition that you've got that I'm not aware of that could be causing the changes that I'm seeing in you? And you're having a fair conversation, confidentially, away from the working environment, without stipulating what you believe the cause is. And it can be tricky, because as soon as you mention the word alcohol or medication, it naturally feels accusatory straight away because you're talking about it. But the only way you can actually talk about it is to talk about it. But like I said, base it on what your concerns are. So mine might be for alcohol. It might be a case that you just smelt alcohol at work and that's all it was. And that's where my question would start. Let's say if it was me and Kim and I was talking to Kim, I can smell alcohol this morning and I don't know why. Talk to me about it. Explain that to me. Help me understand. And it's a fair starting point to come from. But you never want to step into the realms of their private life and saying, well, have you done? Or what did you do? Because that's nothing to do with me. Talk about what you can see or what you can smell or what you can hear, and ask fair questions from that point.
Great. Thanks, Jim. I think we've got time for one or two more quick questions. I'm going to put two together here. So the first one's from Matthew. What about the detrimental effects to mental health that synthetic drugs like spice are having? So that's the first part. And then from an anonymous member, how do you feel about binge drinking? If I put both those questions to you, Judith, to start with.
Okay. So I think the first question is kind of like falling into that category of how drug use can actually cause mental health problems. I'm not quite sure. What the question is kind of like aiming for. But obviously, you know, the mental health problems that come from using drugs, either, you know, synthetic drugs or, you know, alcohol or even nicotine or other less intense drugs, depends on a person on how much of an effect it has on them and how much that plays out. I think we have a lot of evidence that drugs do cause changes in people's psychological well-being, their, you know, behaviors, their social well-being, and we also know that some drug use can change the biology of, you know, the neurochemistry in your brain. And this is when we kind of like then get into, you know, the space of substance use disorders as well, where we actually find that the neurochemistry is changed in the way that we're actually talking about a neurological disease almost at that level. So it doesn't really matter so much what causes what in my experience, because both elements will require treatment and intervention and support. You need to support people to be healthy, to kind of like step away from the risks and the consequences of substance use, but you also need to support them with some mental health aspects that are, you know, leading to them feeling unhealthy or making unhealthy choices. So when we kind of like think about what Kim was talking about, the signs of stress, all of those signs of stress are actually very, very normal parts of human behavior and the human experience. You know, stress is normal. We can kind of like deal with stress. It is always about the point when we reach the point where those symptoms and those experiences become, you know, a problem that can be, you know, for example, dictated by people around us that say, you have a problem. I think you have a problem. Or we can realize that ourselves and say, oh my goodness, I'm behaving or I'm feeling in a way that is problematic for me. So it is more about the level, the threshold, a little bit like Jim explained as well. You know, where does that start? So whether that is a synthetic drug, whether that is kind of like a alcohol or any other type of drug that causes it, doesn't play so much a role. It is more about the effect, the consequences, and what kind of support we need to put around those to make sure that people are safe and healthy.
Thanks, Judith. I'm afraid it's going to have to be the last question. I was conscious of time. We will try to answer the other questions and come back out to people following the webinar where we can. So the last one I put to you, Kim. So again, from an anonymous attendee, is drug and alcohol, are drugs and alcohol something that's spoken about in mental health first aid?
Good question. Not as much as I would want it to be talked about, but we do touch on it. When I say touch on it, we have maybe a 10-15 minute discussion on it. We talk about drinking in excess and the impacts it has on mental health, but that is all.
Great, thank you very much. And thanks again to Judith, Kim, and to Jim for what I hope you'll agree was a fantastic webinar, really insightful, lots of information. And apologies if we didn't get a chance to answer all the questions. We'll try to do that following this where we can. So just a final reminder, we'll be sending out the recording for this webinar hopefully tomorrow, and feel free again to share that with any of your colleagues, anyone that you're working with, and hopefully you can take some of this advice and guidance and start to incorporate into your working and personal lives. But in the interim, thank you very much for your time, and we look forward to seeing you again very soon. Thanks very much.